Hello everyone, this is Dr. Kingston, and in this video we'll be talking about the temporal and infratemporal fossae. To do that, we will describe the significant bony landmarks that are part of these regions, and we'll talk about which structures relate to mastication, which relate to the temporomandibular joint, and which are passages for neurovasculature. Then we'll spend a little bit extra time talking about the pterygoid plates, the muscles that attach there, and the function of the pterygoid hamulus. All right, so let's start off talking about the temporal fossa, which is the more superior of our target spaces for the subjective. The temporal fossa is a shallow depression on the lateral aspect of the cranium. It's bounded superiorly, and really when I say superiorly, I mean like 3/4 of its border. So all of this area here are bounded by the temporal lines. So they make a nice arch that delimits most of the temporal fossa. Its inferior border is the zygomatic arch and the infratemporal crest. Now remember that the zygomatic arch here protrudes laterally. So that is considered the lateral portion of the inferior border, while the infratemporal crest, draw that on there, makes up the medial portion. Medially as a whole, this fossa is bounded by 4 cranial bones. We have frontal, parietal, sphenoid, and temporal that meet up at this spot here called pterion. Now, once upon a time, I used to think that pterion, which means wing, kind of like a pterodactyl is a winged dinosaur, referred to the greater wing of the sphenoid, which you can see right here in yellow. That's the greater wing. But no, it's a bit wackier than that. Pterion actually refers to the wings that Hermes, the Greek messenger god, had on his head. So apparently those sat right here. Pterion, in addition to having some godly significance, also has some humanly significance. You have these 4 bones joining together right here. So structurally, this part of the cranium is a little bit weaker than the rest of the cranial vault. Additionally, you've got the middle meningeal artery passing immediately deep to this spot as it's supplying the cranial meninges, and that makes it very susceptible to injury. So really what I'm saying is don't get whacked in the head at pterion. This is the reason why we've designed helmets especially to protect your temples. All right, we've got 3 of our borders, and our last one, the lateral border, is going to be the temporal fascia that covers up the temporalis muscle. This is a very, very thick fascia, and it's going to provide some additional attachment for the muscle in addition to covering it. Now, that previous view does a great job of showing all the boundaries of the temporal fossa, but it doesn't do a great job of showing the 3-dimensional aspects of it. Ends up kind of looking like a flat circle. So here are a couple of different angles for you to have a look at. What I want you to notice especially here is how deep the temporal fossa gets posterior to the orbit. All right, this is where we have the zygomatic arch swooping out and creating this tunnel. And then we've got the infratemporal crest marking off the other side here. This is where the bulk of communication between I shouldn't say the bulk of all of the communication between the temporal and infratemporal fossa will take place. So we have the tendon and some of the muscle belly of the temporalis muscle passing in this gap here to get down to attach on the mandible. And we are also going to find some of the deep temporal neurovasculature passing through this communication here as well. Inside the temporal fossa, we find the temporalis muscle and its deep neurovascular supply. So note that this is not including that superficial temporal artery or the auriculotemporal nerve that we found on the face here. Those sit superficial to the temporalis fascia, so they're not considered to be in the temporal fossa. Instead, what we include here are the deep temporal nerves and the deep temporal arteries. All right, and we have anterior and posterior branches of each of these. The anterior and posterior deep temporal nerves are a little bit difficult to make out what's what, so they are just kind of labeled as a block in this image. All right, so that is all for the temporal fossa. The infratemporal fossa then sits directly inferior to this. Bring that up here. And that large passageway created by the zygomatic arch, again, is how they communicate. Now, because of the mandibular ramus and some of the complicated shapes of the bones here, the infratemporal fossa is a little bit more difficult to delineate. We can't just draw a nice circle around it like we can with the temporal fossa. So instead, I've highlighted what you can see of it without removing the mandible here. And what I want to make obvious is that we are talking about this space that sits just deep to the mandibular ramus. Okay? Its superior border is going to be the zygomatic arch and infratemporal crest of the sphenoid again. So temporal fossa's inferior border is the infratemporal fossa's superior border. This is going to include this entire jagged surface right here. Okay? Anteriorly, it's going to be bound by the maxilla, and posteriorly by some pieces of the temporal bone. So specifically, we've got these big protrusions here, the mastoid process, the styloid process, and then also a little bit of the tympanic plate that closes off the middle ear. Medially, our boundary is the lateral pterygoid plate, which you can sit right here. This is a projection of the sphenoid bone. And then laterally, the whole space is closed off by the mandibular ramus, which is not pictured here. It's open inferiorly, but we're going to make pretend that it has an inferior margin right where the medial pterygoid muscle inserts at the mandibular angle. So all told, these boundaries give the infratemporal fossa a roughly cylindrical shape or cone shape that's wide at the top in all directions, and then it narrows down as you move inferiorly within it. Now, I listed the lateral pterygoid plate as the medial border of the infratemporal fossa earlier, but I want to take a few extra minutes here to delve into what the pterygoid plates are and why they're important. These are plates that project inferiorly from the sphenoid bone. So over here on the right, you can see the greater wing of the sphenoid right here, and you can see the lateral pterygoid plate projecting inferiorly from that. All right. The medial pterygoid plate is visible over here on the left image. So here's that. And then here's the lateral again, right next to it. These are set at about a 45-degree angle to one another. So the medial sits in the sagittal plane, and the lateral pterygoid plate kind of flares out at about 45 degrees. Okay. That means in between them, we have a little gap called the pterygoid fossa. Okay, as you can see here, this lateral pterygoid plate is broader and flares posterior laterally, while the medial is much narrower and has a large hook or hamulus coming off its posterior inferior border. So I've got my highlighter right on there, and you can see it again over in this image here, this little jut of bone that sticks out there. Okay, both of these plates are important as they serve as attachment points for muscles. So let's take a quick look at them individually. The lateral pterygoid plate, again, is the medial border of the infratemporal fossa. And specifically, I'm talking about its lateral surface there, so the part shaded in blue that you can see over on the right. The lateral pterygoid plate is the proximal attachment point for the pterygoid muscles. There are two of those. So we have a lateral pterygoid muscle that attaches to the lateral surface of the lateral plate, and a medial pterygoid muscle that attaches to the medial surface of the lateral pterygoid plate. And that is a lot of medial and lateral to say. So I want you to think of this as the medial and lateral pterygoid muscles making a sandwich of the lateral pterygoid plate. One muscle on each side. Their name tells you exactly where they are, and that lateral plate is right in the middle. The medial pterygoid plate then is deep to the infratemporal fossa, just barely. And it's more closely associated with the muscles of the pharynx. So we have the superior pharyngeal constrictor attaching to its posterior edge, and the pterygomandibular raphe that connects the superior constrictor over to the buccinator muscle in the cheek attaches to the pterygoid hamulus, which again is this little hook on the tip. All right. That pterygoid hamulus is also related to the palate musculature in kind of an interesting way. So the tensor veli palatini muscle has its origin on the lateral surface of the medial pterygoid plate, which is a neat way of saying its muscle belly hangs out right here in this little gap in between the two pterygoid plates, okay? Its tendon, though, actually wraps around the hamulus and bends up medially to meet up with its counterpart from the other side. So we're going to draw its tendon like that. There's coming from the right. We've also got one coming over here from the left, and these meet in the midline like that. So when these fire, like so, they end up pulling your soft palate taut. Like all regions of the head, the infratemporal fossa has a number of foramina and fissures that it uses to communicate with surrounding areas. Anteriorly, the infraorbital fissure will take you into the orbit. Medially, the pterygomaxillary fissure will take you into the pterygopalatine fossa. Superiorly, the foramen ovale and foramen spinosum will take you up into the middle cranial cavity. And finally, if we head way back to the posterior aspect of the fossa, we find the petrotympanic fissure, which will take you up into the middle ear. We are going to be talking in a lot more detail about the structures that pass through these communications in other learning objectives for this region. So for right now, I want you to just start getting comfortable with the names of these passageways. The infratemporal fossa is primarily filled with the muscles of mastication and the neurovasculature that serves them. So we have the medial and lateral pterygoid muscles entirely located within the fossa, and then we have the inferior-most part of temporalis along with its tendon that travels down deep to the zygomatic arch from the temporal fossa. Traveling in and around these muscles then are blood vessels. So we have the maxillary artery, which you can see here. This is pink vessel right there. This is one of the terminal branches of the external carotid artery. And it will travel through the infratemporal fossa and give off branches to the midface. Instead of having a long maxillary vein that mirrors it then, in its place, what we have is a very extensive network here of smaller veins called the pterygoid plexus of veins, okay, because it's sitting on top of the pterygoid muscles. And these take the place of a maxillary vein. They drain all the same areas that the maxillary artery supplies. And then they take that blood and send it back to a very short little maxillary vein that drains back to the retromandibular vein. All right, continuing deep down into the infratemporal fossas, deep to those muscles of mastication, we find the nerves that supply this region. The big nerve here is going to be the mandibular nerve, or V3. It is going to exit out of foramen ovale directly into the infratemporal fossa here. So here it is coming out of foramen ovale. And as it does that, you can tell it gets kind of big and fat. And in fact, here is where you would find the otic ganglion. You may find it as kind of a knot-like structure on the posterior surface here, or you may find that it's just a portion of the nerve that swells up and gets very large. The branches of V3 then all sort of stem from this point, as we will go over in a separate learning objective. But just to summarize here, we have fibers from the otic ganglion that will serve the parotid salivary gland. And in this region is also where we find chorda tympani coming from the facial nerve. And this traveling down is this tiny little branch here that's going to join up with the lingual nerve. And that will make its way down, hitchhiking to get to the submandibular ganglion, which will eventually serve the submandibular and sublingual glands. All right, and that is going to bring us to the end. So here is your review question. What structure passes through the petrotympanic fissure? And the correct answer here is the chorda tympani. So once again, chorda tympani comes out through the petrotympanic fissure after it has passed through the middle ear, comes into the infratemporal fossa, and joins up, hitchhikes with the lingual nerve to get to the submandibular ganglion. And that is going to bring us to the end. Thank you for joining me.